electron need to be withheld for at least 4 hours prior to test. Now, what are the parametric criteria for diagnosis of COPD? FEV1 and FVC ratio below 0.7 and FEV1 below 80% of predicted value. Gold guidelines for COPD stipulate that this should be post-bronchodilator 15 minutes after 400 microgram salbutamol or equivalent. These are the some spirometric tracing. This spirometry shows the obstructive ventricular disorder with positive bronchodilator response. Then there are some conditions where we suspect bronchial asthma, but initial spirometry result shows normal result. In that case, we do bronchoprovocation study. The susceptible patients are covalent asthma, mild intermediate asthma, and sometimes chronic bronchitis. In that case, bronchoprovocation study is done, and there are various agents which are used in bronchoprovocation study. Among them, methacholine challenge is the most commonly used. Here, gradually increasing doses of methacholine are administered, and FEV1 is measured. The concentration which causes FEV1 reduction 12% from baseline, that concentration is called PC20. Lower the PC20, more likely that patient has bronchial asthma. Here the PC20 is 1.3 milligram per ml. So the methacholine bronchoprovocation study is normal, positive, and the patient has hypersensitive airways. That is, patient has asthma.
Topics. Next speaker. Directly of this learned audience. Actually, I got nothing to say because all the papers were said was very explanatory and needs no explanation further. But I raised some questions regarding, or to just recapitulating as a clinician what we face during management of the asthma. Dr. Bishash has rightly mentioned that situation of asthma and COPD in Bangladesh perspective and the trend of treatment, the knowledge regarding asthma in our population is rightly mentioned. And he also mentioned the treatment pattern that about 90% of our treating physicians are not prescribing preventers for management of the asthma situation. This is the knowledge regarding of our general practitioners. What's about the patient's perspective? How many of our patients is quite capable to use inhaler correctly? He has not mentioned it. If he could mention it, if we take the history or assess the general population, about 60% of the patients who are using inhaler, they are not using inhaler in a correct form. So this another thing should be mentioned, and that's why the patient needs education regarding the use of the inhaler. Moreover, as a whole asthma patient, the basics of the management of the asthma patient should be the education of the asthma to the patient by the physician concerned, and before that almost all the physicians who is treating asthma, they should be trained, and the Asthma Association has rightly taken up a program that they will train the general practitioner to train the management of asthma. They have rightly taken that program in their what they have informed us. Regarding the second paper, as he has rightly mentioned, Dr. Muhammad Aminul Islam, the 6-minute study, 6-minute walking distance covered by asthma patient and normal. This is very obviously that any patient who is having breathing difficulties will not be able to cover the same distance. It's a very easy test, and they can grade it. How much distance, whether it is episodic bronchial asthma or persistent bronchial asthma or COPD. But there are much more easier tests there, and we are practicing in selecting our patient. That is the simple measurement of the chest expansibility. Simple, which is much more.
Dr. Sheraton, please come on the desk to receive your token required appreciation from the hand of this airport. Dr. Muhammad Aminul Islam, Dr. M.D. Rizal Islam.
Here I like to feel proud that Mr. Sheraton is one of my direct students. He is also my direct student while I was working in Dhaka. That also I speak as while my direct student, I feel proud that I am carrying that message.
Every speaker will get only 8 minutes. Please try to.
My teachers and my fellow colleagues, Assalamu alaikum. My topic is the diabetes, relationship with diabetes and bronchial asthma, as both are the chronic disease. As you know, asthma is a chronic disorder airway with significant mortality and morbidity, and about 3 million people in the world currently suffering from this disease. And by the year 2025, another 100 million people will be added with this disease. In our country, as per study of the NAS, 7 million people are suffering from this disease. They represent the 5.2% population of our country. In diabetes, is a global epidemic, and about more than 150 million people are suffering from this disease the year 2000, and projected that by the year 2025 there will be 3 million new cases, and majority of this increase the rate of diabetes will be occurring in the developing countries like Bangladesh, India, and Pakistan. And prevalence of the disease, and interestingly, almost 10% of the two diseases, asthma and diabetes, 5.2% in our study in our country. And this is a trend of burden, how to rapidly increase the disease, diabetes in our country. So, is there a relationship of these two chronic diseases? With this, is there any relationship with diabetes? Like, the diabetes is related with